Chapter 4, Health Service Professionals. We'll jump right in this. I found this chapter to be interesting, so hopefully you guys will also. Okay, so learning objectives are listed in the book and in the PowerPoint. A couple of learning objectives. The introduction on page 138 does an excellent job speaking to how vast the healthcare sector is. It is actually 17.1% of the United States gross domestic product. That just shows much how wide, what is the word I'm looking for? How lucrative the healthcare industry can be if we can perfect it. There's still so many good things, bad things, right things, wrong things, but wow, 17% of the gross domestic product. I'm curious to know what things like Amazon is or entertainment compared to healthcare. Anyway, I'll have to Google that on my own time. The chapter also goes over the demand for healthcare services. I'm sorry, I said the chapter, I meant the introduction. Healthcare professionals are among the most well educated and diverse of labor groups. I found that sentence to be quite interesting. The variety of healthcare settings is also vast and it's ever changing. So that includes hospitals, managed care organizations, nursing care facilities, mental health institutions, like the list just keeps going. Health centers, migrant health centers, mental health centers on page 138. Be sure and take a look at that. The one of the reasons for expansion or the increase of healthcare is the increased insurance coverage that came along with the Affordable Care Act, and um, the expansion of Medicaid, Medicare. So people having more insurance has drawn them to go to the doctors more, take better care of themselves more. Table 4.1 on page 39 has some great information there, gives you some numbers and stats to compare. And if you take a look, some of this information is from 2014, 2016, so it's outdated at this point, but still relevant, like still eye-opening. So physicians starts on page 140. Physicians obviously have to go to school and they obtain a license to work. They are engaged. Physicians can be engaged in medical education, research, preventing illness. It speaks of how they attend a residency. So most physicians go to school for several years. You have college, then you have med school, and then you have a residency if you're going to do specialty work. It's years. And totally worth it if that's your calling, if that's what you want to do. There's differences between MDs and DOs. The PowerPoint also goes over that. So a DO, a doctor of osteopathy, is someone who emphasizes the musculoskeletal system, and then MDs are allopathic. They treat as something happens. The interventions begin when something happens. Um, I think the book stated, and this is my experience also, that the DOs focus on prevention more so than doctors. MDs will treat when something occurs, but not a lot of prevention. And approximately 8.8% of all physicians in the United States are osteopaths. So I found that to be a low number and rather interesting. The chapter continues the difference between, excuse me, generalists and specialists. Work settings and practice patterns have changed. They continue to change. There's an expanding role of hospitalists that, even in my nursing career, that was something new that came about maybe 15, 18 years ago-ish. And it actually has improved the quality of care at the hospital as in most other facilities because it's convenient to have that on-site availability when if there's a medical crisis, if somebody needs somebody immediately, you're not waiting the next day for the primary care physician to show up. um, Let me back up a little bit. On page 145 it discussed the differences between primary care and specialty care. So primary care should be, in a perfect world, it would be that first contact of a healthcare, someone who generalizes in overall health, and managed care has actually forced managed health care. I mean, like health insurance and rules and laws has requires a primary care oftentimes to give you a referral. So some insurances will not allow you to go to an allergist unless you've been to your primary care and your primary care says you need to go to an allergist, and vice versa. It's just a personal experience. My insurance doesn't require a referral, but yet I called a practitioner office last week, and they wouldn't even book an appointment for me unless I had a referral, even though my insurance doesn't require it. So it could be insurance required, it could be practice required. I actually was shocked that they were expecting me to get a referral. So I did not make the appointment. um, that's how it can impact. Primary care also focuses longitudinal. So you have a primary care doctor for 20, 30, 40, 60 years as long as they're practicing, and you take really good care of yourself. Whereas a specialty person, you may only see that person depending on what it is, maybe once every 5 years, or maybe only once in your life. Maybe you only need to go to an allergist once. Whereas if you have stomach issues, you would go to a gastroenterologist, twice a year, 3 times a year, etc. All right, page 146 and 147 speaks of the hospitalist role again. You can read that. Um, the PowerPoint is mentioning the issues in medical practice training and supply. That's on page 147. Medical training is very important, obviously. We weren't well prepared, but it was interesting to see how much medical training in this little paragraph section, if you will, it mentions about payments, how Medicare programs will pay for the training of the doctors. That was something I was not aware of. So just interesting stuff there. Now, supply of medical professionals. I am here to tell you there is a shortage of doctors. There is a shortage of nurses. There's a huge shortage of our ancillary or support staff post COVID. We had a shortage to speak of prior to. So this book was written, hang on, bear with me, 2019. So the information in this book is from 2014, 2016, maybe some 2018 information is cited throughout this book. But in 2019, it was referencing the shortage. It is worst post-COVID. During COVID, just with everything that came with COVID, the intensity of the patient care, the number of patients who needed care, the political issues that surrounded COVID, the social issues that surrounded COVID. Nurses, I can speak for my profession, nurses left in large amounts. They walked away from nursing altogether. They are either doing hair, selling real estate, um, YouTubers, TikTokers, whatever they're doing to earn an income, but they left the profession. There is a true nursing shortage, a true medical doctor shortage. The primary care workforce is shrinking. I don't know how we're going to fix it, to be honest. And not only is the shortage an issue, but also maldistribution. So, for example, you could fly out to LA and have any corner block of roads have 2 or 3 plastic surgeons, and very likely dentists who do the veneers and this and that. Whereas in Raleigh, North Carolina, we have those providers, but not a whole lot. The population does not demand those services quite like LA or maybe even New York City, Miami. I'm sure they're all over. I can't think of some of the bigger names. Houston, is in Texas. I'm sure. Even somewhere out in Wyoming, but I don't know a town out in that area. Anyway, my point is maldistribution is a real thing. The huge shortage areas for healthcare lies in rural populations that even as a graduating student from uh, dentistry, dental assisting, nursing, and there's a couple other ones listed, you can even get loan assistance to repay your loans if you work in a rural setting for X amount of years. So there is a huge shortage in rural on top of the national shortage. And I am trying to keep my videos short so that I don't have an issue with the whole time limit thing. So I'm going back and forth between the PowerPoint and the book. Page 50. I've got it highlighted. Physicians that are entering the primary care has decreased. growth of new medical technology is one major driving force behind the increasing number of specialists. So if you are going to school to be a doctor, I mean, why not go into a specialty practice? You actually make more money, you get more specialized training, you get the latest, greatest technology tools at your fingertips. So I can see the attraction to that. But it doesn't help with the primary care sector. We still have to have good primary care doctors. Ba, 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 ba. So page 151, I highlighted the imbalance between generalists and specialists. That does have undesirable consequences, but it levels out. Okay, so PowerPoint talks about the ratio of the U.S. population growing, the approximately 25.5% of professionally active U.S. physicians, still an estimated one-fourth of residents. Yes, okay. Dentists. Let's continue. Page 153 in the book. The dentists have to have license to practice and they graduate from an accredited dental school. And there are 9 specialty areas recognized in dental on page 153. I'll let you read that. Dental hygienists are the equivalent, in my opinion, to nurses. So the dentist is the equivalent to a doctor. The dental hygienist is the equivalent to a nurse. And dental assistants actually, they get a certificate from a dental school, but they do not have to have a license to work. I found that to be interesting. Pharmacists go to school. They have to pass a board. They have licensing requirements. And then page 155 goes into other doctoral level health professions, optometrists, psychologists, podiatrists, feet doctors, what a podiatrist is, chiropractors. I'm flipping through. Okay, now I think I'm caught up. Okay, so nurses. Nurses constitute the largest group of health professionals, healthcare professionals. That's just, it is what it is. There are more nursing schools, there are more nurses compared to medical schools and doctors, and even compared to physical therapy programs, occupational therapy programs. It's just nursing is the highest number. In nursing, you can actually earn a doctoral degree, but it's not a medical doctor or osteopathic doctor degree. It is it it solidifies your research as a nurse, and that is described on page 156, right above the paragraph right above where it starts talking about nurses. And there are different types of nurses. There's registered nurses, where you can earn an associate degree, a bachelor degree, or even an MSN, a master's of science in nursing. That's not mentioned in this book, but there are 3 levels for registered nurses: ADN, BSN, and MSN. And then there's licensed practical nurses. These nurses, this level actually 20 years ago-ish, they were talking about getting rid of it, but it is still there, and it is still a great program that graduates excellent nurses. The LPNs typically work in nursing homes settings, maybe some home health care settings, because there are certain things that LPNs cannot do that RNs can do. Again, shortage is a real thing. It got worse after COVID. I said that a while ago, a few minutes ago. Advanced practice nurses. So this is where we get our nurse anesthetists, CRNAs, our nurse practitioners, nurse midwives. You can actually continue your education as a nurse and practice as a nurse practitioner, which is very similar to a PA, doctor, certified nurse midwives. These people can actually treat, write prescriptions, diagnose, order labs. Am I getting ahead of myself? Okay, so these are what we call mid-level providers on page 158. And MLPs make up a good portion of our healthcare system. Okay, I'm going to keep flipping pages. Allied Health on page 160. Oh, let me go back to this PowerPoint. Mid-level providers do not have an MD or DO degree. They receive less trainings than physicians, but more than RNs. So instead of you get your RN and then you go further to become a nurse practitioner, nurse midwife, CRNA, and physician assistant programs are existent too. East Carolina offers one I know of, and all of these mid-level providers work under a doctor's orders or doctor's credentials or doctor's licensing, even though they're separately licensed. They do a little bit more than your nurse who's just working in the ER, and I did not mean to say just, but the nurse who's working in the ER or the ICU, they do not perform at the same level as a nurse practitioner, midwife, physician assistant. The more school you go to, the more power you have, the more scope in your practice that you have. Allied health professionals, this Exhibit 4.2 lists them great on page 161. They are so important, and I assure you, in a healthcare facility, the janitor and the volunteer are just as important as the CEO and board of directors and everybody in between. So our allied health professionals are just as important to us as our licensed professionals who go to school for 10 years. It just doesn't matter. Everybody's important. Page 163 are health service administrators. That falls under the line of everybody's important too. These people, there's top, mid, and entry level type of jobs when you are talking about health service administrators. And the degree programs in colleges are becoming more available for these different masters in public and health, these different degrees. That's what I was trying to say. Public Administration Affairs, Health Service Administration. There's even a health information one that has come out lately. Some universities have picked that up. Page 165, Global Health Workforce Challenges. It is real. Read that. The dates are old, but these problems still exist. The shortages and just the demand, the overall demand. Again, the health service professionals is a large labor force. Physicians play a leading role. Nurses make up the most majority of those healthcare professionals. And we just face challenges all the time. It's ever changing and so rewarding, so rewarding. So I always highly recommend healthcare as a career. Okay, that was a rather short chapter, and I just had a lot to say. Please let me know if you have any questions.